third procedure, which is the parental medication. First, prepare and gather all the materials needed for the procedure for us to minimize the effort and to save time. As shown, these are different materials that are needed. First, we need to prepare medication using an ampule. Check the medication card, calculate accurate medication dosage. Prepare the syringe and sterile gauze. Cover the neck of the ampule with sterile gauze and break the neck using proper technique in order to prevent the injury to ourselves. Once the neck has been broken, then insert the needle of the syringe without touching the neck in order to prevent the contamination. Slightly tilt the ampule and aspirate the desired dosage without spillage. Recapping the syringe, we have two ways. First, scooping method as shown. Second, by using the forceps to cover the needle as shown. Then place the syringe inside the medication tray with the needle recap. This procedure is preparing medication in a vial. Using pick-up forceps, remove the injecting needle, replace with aspirating needle as shown. Then, draw equivalent amount of air. Disinfect the rubber stopper of the water. Inject the draw air inside the vial. Aspirate the sterile water, equivalent volume of the equivalent volume air injected of 5 ml. Sterile water. Next is to check the doctor's order, calculate accurate medication dosage. Remove cover, lid, and disinfect the center of the rubber stopper using alcohol pad. Insert the needle of the syringe at the center of the rubber stopper. Inject the water into the vial. Roll vial in between palm of your hands to completely dissolve the medication. Performance phase. Identify the client correctly. Explain the procedure to the client. Provide privacy. Apply gloves as indicated by hospital policy. Next procedure, the parenteral medication administered via subcutaneous injection. Clean site with alcohol swab and allow to dry. Get the prepared syringe from the medication tray and uncup. Using non-dominant hand, pinch the skin of the selected site. Insert the needle with bevel facing up at 45 degrees angle. Support the hub of the syringe. Withdraw plunger to check for backflow of blood. Inject the medication, then withdraw needle gently. Wipe excess medication without applying pressure on the injection site. Do not massage the site. Dispose syringe properly. Next procedure is the parenteral medication administered via intramuscular injection. Select appropriate site for injection. Clean site with alcohol swab and allow it to dry. Place alcohol swab between index and middle finger of non-dominant hand. Get syringe from medication tray and uncup needle. Using non-dominant hand, pinch the skin of the selected site, holding the syringe in a dart-like position. Inject needle at a 90 degrees angle. Support the hub of the syringe. Draw the plunger to check the backflow of the blood. Inject medication, then withdraw the needle gently. Move the alcohol swab from the non-dominant hand and place it over the injection site, applying pressure and massage the injection site with the swab. Dispose syringe properly. Observe patient for any reaction to the medication, then document the time of administration.